Yeah, you got to get rid of root canals, and you got to have them cleaned out really thoroughly with a good biological dentist, and then ozonated and lasered to make sure it's sterile, and then filled in with your own like platelet-rich plasma or platelet-rich fibrin-rich plasma. Right, they put it in there, and that means that. So you're not going to get any invasion. You're protected. But both titanium and zirconium cause problems because when we look at where they're put it, where they go when they go into the bone. I have a really dear friend who's biological dentist in the UK and Germany now, and she was telling me the other day that even zirconium and titanium are cause. If you do X-rays, you can see that around the bone where it was inserted, there's it's wearing away, it's oxidized, it's causing, which means that it's a nidus for infection and all kinds of problems. So she says she's been having really good successes with certain ceramics and things like that. But you'd have to find her. But you got to find someone who really knows what they're doing about it, right? A lot of times, what you're stuck with is just really to get some dentures, because if you can get dentures, or find her or someone like her, if you can get dentures, at least you can eat and need to eat, right? Oh, I heard we were having this little group of doctors talking, and they were talking about, I guess it was a group of people somewhere. What they do is, I think at age 40, they get all their teeth pulled out, and they live really long. And someone asked them, well, why did you pull all your teeth out? So he goes, because I only have to go to the dentist once then. I love that answer. But I'm not saying you have to do that. It's just you gotta really be on top of taking care of your teeth. It's really, really, really probably been one of the main causes of death on planet Earth for eons. And I imagine if we lived in a pristine, beautiful, fantastic, wonderful world that God made for us, and we were eating the foods that God produced, not that the chef produced. If we were eating that way, and we were going to bed with the sunset, and we were waking up just before dawn, if we were living a life like that, and we were moving around all day, probably, I wonder if these 140-year-old Hunzes are having any deeply embedded dental infections. No, because they'd be dead. So I have a feeling that it's all connected. My question is, how in the world, how did the mouth ever leave the body? Right? How did the dental profession and the medical profession become two different professions? Ridiculous.